Very common thing I see are people that are suffering with acid reflux. Um, Acid reflux is where you feel like you either have just burning in your stomach that ascends up the esophagus and burns your esophagus. You have a burning feeling in the chest and sometimes in the throat. Or sometimes people don't actually feel burning in the stomach and the esophagus, but they have a sore throat. And sometimes you can even have unusual things um, like asthma exacerbations because you've actually been refluxing acid into the bronchioles, or chronic ear infections, which is from acid going into the eustachian tubes. And sometimes people are not actually refluxing acid liquid, but it's like acid vapor. And that can cause some of the same symptoms. So, anyway, it's a pretty common thing. And what causes it? And what can you do about it? So, one of the most common causes I find is food allergies. So, if someone's eating a food that they're allergic to, let's say it's dairy or gluten or garlic or something like that, every time they eat the food, an immune reaction can take place that can actually damage the lining of the stomach and actually impair the cells that make acid. And paradoxically, the acid level goes down. And you need a certain amount of acid to trigger a reflux that closes a sphincter between your stomach and esophagus. If you don't have enough, that sphincter remains open and you can reflux acid and acid vapors upward. So that's one of the causes. And plus, the immune reaction on the stomach lining can just kind of make the stomach feel raw, and then the bit of acid that's in the stomach can burn the stomach lining. So that's one cause. Another cause is Helicobacter pylori. So that's a bacteria that can grow in the stomach and small intestine, and under normal circumstances it's almost like a friendly flora, but sometimes the bacteria can evolve and begin to express genes that allow it to be more invasive, so that it invades into the mucosa and can cause a dysregulation there and even ulcers sometimes. And that can also lead to increased acid production and acid reflux. Another cause is where someone actually has poor intestinal motility. So in terms of the acid that's being produced, it doesn't go forward, it tends to stagnate and back up. So poor intestinal motility can lead to the backing up of digestive juices, including acid, and that can cause some of the symptoms. So what causes poor intestinal motility? Well, sometimes small bowel overgrowth. That the bacteria growing there can kind of like damage the nerves involved in the peristalsis that kind of whisk things forward and can lead to this stasis and acid reflux. So you usually need to figure out like the underlying cause, eliminate that, whether it's taking foods out of your diet you're allergic to after doing like a modified elimination diet or some food allergy testing, or if do a test for small bowel overgrowth and treat that if you find it. And then there are things that you can do from a natural standpoint that are just relieving to the symptoms. You can use deglycerated licorice chewable tablets. Now, this is a form of licorice that has glycyrrhizin taken out of it, which is good because that has the possible side effect of raising your blood pressure, and the deglycerated form does not. So they usually come in little chewable tablets, and you can chew 3 or 5 of these in between meals, and that creates like a protective slurry that can heal your stomach lining as well as protect it. And there are other herbs that have a similar effect that create this kind of protective mucilaginous layer. So marshmallow root and slippery elm, for example. So there's a concoction used for sore throats that's a tea called throat coat tea, and that can be very soothing in the stomach and small intestine as well. And then, of course, some people need pharmaceuticals, and sometimes a temporary use of an acid blocking medication can kind of reduce acid production if it's excessive, and almost like get you out of a bad cycle, and then you can get off of it without having any sort of rebound. So that often happens. And then of course our autonomic nervous system plays a big role in how much acid we produce. When we're under stress, we're going to produce more. So, any kinds of relaxation techniques that you have, like meditation and yoga and mindfulness and general exercise, can help. I hope that helps.